Hello. Today I would like to speak about fibromyalgia. There are lots of people suffering from this mysterious disease. Fortunately, there are good news for those who suffer from fibromyalgia. There are a few things you need to know about fibromyalgia. Number one, it is not a bodily disease. It is a condition. Number two, you are absolutely healthy. There is nothing wrong with you. And I will explain about this later. Number three, you can help yourself out of this. Who's going to help you out? For example, I will help you out because this is what I'm doing right now. I'm helping you out. But the biggest help you're going to get is only from yourself. Only you can help you out. Let me tell you something. You probably suffering from pain everywhere in your body, neck and back and maybe elbows and knees, or most likely ankles. You also probably suffer from anxiety, depression, and all this kind of stuff. Ladies and gentlemen, I have something to tell you. Fibromyalgia is a mental condition. No, don't get me wrong. I know you're gonna turn off now this video because you don't want to hear that you are mentally sick, because you are not. You are not mentally sick. You're absolutely healthy person. Your body is healthy. You're suffering from very common condition when, in simple language, you are overwhelmed from things that happen in your life. The good news again, you can come out from this, and I will point you into right resources. Your story is probably something like this. Things hurt you everywhere, you go to doctor, they don't know what to do, you go to 3-4 doctors, and you end up in a rheumatology office, and they say, okay, you have fibromyalgia, you maybe do some CAT scans, blood tests, and nothing shows anything, unless you have some serious disease that's going on, or some kind of condition that's going on besides what you have. And that's fine. At this point, you really need to, distinguish somehow between your pains and that other condition. For example, you have a diabetes, but there are thousands of people with diabetes who don't have any pains, right? Believe me, if you've been diagnosed with fibromyalgia, consider this. It is your lucky day. You have a way out of this. There is a way out. Originally, I didn't want to put down any names, but I have to say, within the scope of latest developments, I have to say where to look for help. There is a guy called John Sarna. It's a doctor. I'm not a doctor. I can just recommend you what to do. But John Sarna is a medical doctor. He is been working with patients suffering from pain. His methods not widely accepted. Of course, his methods are mostly mental training, psychotherapy, but not for everybody. Many people can heal themselves, although he considers fibromyalgia to be one of the, sort of toughest cases. And cognitive behavior therapy. And I explain to you this. I think that you can learn yourself about what's really causing this fibromyalgia by reading Dr. Sarna's books. you need to deeply understand the material he's writing about. It's not just like, okay, you read about, oh, okay. No, it's not working like this. You have to have deep understanding of what he's writing about. You need to absolutely trust that that's what you have and not some kind of bodily disease. And then there is cognitive therapy. I truly recommend reading some books, especially on anger. The author of really good books is Dr. Albert Ellis. And here's the thing, there is a psychoanalysis and behavioral therapy. To me, it works like this. If you are having fibromyalgia, you have some unconscious issues, okay? Your unconscious mind basically driving you crazy, okay? You will really benefit from psychoanalysis. But if you learn how to do it, and if you understand, okay, the works of Dr. Sarna, because his works are really based on works of all this great psychoanalysis that from the past, you know, Sigmund Freud and Alfred Adler and Franz Alexander. Okay, you can search these people, you know, online. If you deeply understand what Dr. Sarna is talking about in his book, you will be able to use your imagination, yes, your imagination, to understand what's happening really in your brain, why you're having this fibromyalgia or other symptoms. Because you see, you maybe think, oh, that's my body, is something wrong, I can't fix it. But hey, listen, your blood test is normal, your neurological exam is normal, your MRI probably of your brain is normal too. Okay, if everything is normal, you think about it. This is your mind. So, when you dig out all the reasons why you have this, and you're able to basically discuss them with yourself and view them from different angles, because the therapist really cannot fix you. The therapist can show you the way how to heal yourself. You can do it yourself. You can do it. And then you should utilize all the great works of Dr. Albert Ellis, okay, for cognitive behavioral therapy. This is gonna be your new philosophy, okay, new approach to your life, okay? And if you do it long enough, you'll completely heal. Like, you will heal from all these ailments that you have. It's not gonna be fast. Yeah, Americans are crazy. Okay, they want, okay, give me that pill, and I'm gonna get better. And unfortunately, your doctor probably said, okay, here's your pill, Prozac, Lexapro, anything like that. You're gonna feel better. Or maybe some of those clonazepam, lorazepam. Sounds familiar? Well, you'll probably ask me right now, how this guy, who you are, really? Why are you talking about this? Well, I personally, you know, did not use any kind of mental therapy or anything, but I'm familiar with these things, thanks to some of my friends and relatives, okay, and I learned psychology quite a lot. I can assure you that I also have bad days, you know, when my brain goes like, wow. At that moment, you know, sometimes I even get like a pain, you know, like over my arm. Like, oh, is that heart attack, right? My arm hurts. First signal of the heart attack, left arm, pain. No, you have to do this. Sit down, close your eyes, think about all the negative things that happened to you in the last, let's say, a year. Just imagine this. Imagine a table, like a, you know, you're drawing a table on a list of paper. Then in one column, you list all the negative emotions, negative things that happen to you, everything that you accept as negative.